Why do people with depression often develop sex addiction and become pleasure machines? We often associate depression with indifference, assuming that people with depression have no interest in sex. In reality, the situation is far more complex. Let's examine this issue from both psychological and physiological perspectives. Psychological perspective. How does sex addiction develop? In psychology, there is a concept called mentalization defense. When people face unbearable negative emotions, their subconscious may transform these emotions into a more acceptable psychological state. Among individuals with depression, especially those with weaker psychological resilience, this often manifests as seeking pleasure in the midst of anxiety, loneliness, or sadness. Such behaviors can include compulsive sex, binge eating, or alcoholism. Sex addiction is one expression of this defense mechanism. Sexual activity itself activates the dopamine system, producing brief moments of pleasure and satisfaction. These fleeting sensations can temporarily ease inner pain and make a person feel alive. Some individuals with depression, due to low self-esteem, may use sexual behavior to affirm their own existence. They draw a sense of value from their partner's attention and dependence, creating the illusion of "I still matter." In a depressive state, even this short-lived self-affirmation can feel immensely precious, no matter how fleeting it is. Substitution for negative emotions. Sex as an anesthetic. Some people use sex as an emotional regulation strategy, similar to drug addiction. During intimacy, their negative emotions are briefly replaced by pleasure. However, once the passion fades, feelings of emptiness, guilt, and shame return even more intensely. This rebound effect deepens their depression, leading them into a vicious cycle of depression, right pointing arrow, sex, right pointing arrow, guilt, right pointing arrow, deeper depression. Physiological perspective. The brain's pleasure trap. Dopamine deficiency. Dopamine is a neurotransmitter that regulates pleasure and reward mechanisms in the brain. Under normal circumstances, activities such as exercise, socializing, or pursuing hobbies release dopamine, generating happiness. But in people with depression, dopamine secretion is significantly reduced, causing loss of interest and vitality. In this state, sexual activity becomes one of the few quick ways to boost dopamine. In that moment, a surge of dopamine creates temporary excitement and satisfaction. As a result, some depressed individuals repeatedly seek such stimulation, gradually developing sex addiction. Overactivation of the HPA axis. People with depression often experience hyperactivity of the HPA axis, hypothalamic pituitary adrenal axis, which raises cortisol levels. This stress hormone keeps the body in a constant state of tension and anxiety. Intimacy can temporarily reduce cortisol levels, easing the stress response and allowing them to briefly escape emotional pressure. The vicious cycle of sex addiction. Why is it so hard to break free? After the pleasure fades, people with depression often sink into deeper self-denial. These emotional highs and lows resemble a roller coaster, gradually eroding their ability to control their own behavior. They know this pattern is harmful, yet cannot stop, because the alternation of pleasure and emptiness reinforces the addictive cycle. In addition, many depressed individuals experience overwhelming guilt and shame after repeated relapses. The psychological pressure from failing again and again makes them feel guilty about their lack of control, and even question their morality and self-worth, further intensifying the depression. How to overcome sex addiction. Face trauma and find the root cause. Sex addiction often stems from unresolved psychological trauma, which may originate from childhood experiences, family conflict, or social setbacks. Instead of forcing oneself to stop intimacy, it is more effective to first accept and understand one's own pain. Only by confronting inner wounds can desires gradually subside. Rebuild dopamine pathways and seek healthy pleasures. Beyond intimacy, activities such as exercise, artistic creation, and social interaction can also boost dopamine levels. By cultivating these healthier sources of pleasure, one can slowly weaken reliance on sex as an outlet. Even playing video games can sometimes serve as a positive alternative.